Mechanical principles of orthodontic appliances. Introduction. Importance of biomechanics in orthodontics. In orthodontics, biomechanics refers to the study of how mechanical forces interact with biological tissues, particularly teeth, bone, and the periodontal ligament. It encompasses the principles governing how orthodontic appliances generate forces and moments to move teeth efficiently and safely. Role of mechanical principles in treatment planning. Incorporating mechanical principles into orthodontic treatment planning involves diagnosis and assessment, appliance selection, force system design, monitoring, and adjustment. Basic biomechanical concepts include force, center of resistance, and moment. Forces in orthodontics. In orthodontics, a force is defined as any action that results in a change in the motion of an object. Specifically, it refers to the mechanical load applied to the teeth to induce a movement. This force is a vector quantity, meaning it has both magnitude and direction. In orthodontic practice, forces are typically measured in grams, ounces, or newton. Key characteristics of orthodontic forces. First, force magnitude. It is the strength of a force applied. Applying an optimal force magnitude is crucial. Excessive force can damage periodontal tissue, while insufficient forces may be ineffective. Direction. The path along which the force is applied or act. The direction determines the type of tooth movement achieved, such as tipping, translation, or rotation. Point of application, the specific location on the tooth or appliance where the force is applied. This influences how the tooth responds to the force. Then duration, the length of time the force is applied. Sustained force over time lead to effective tooth movement through bone remodeling. Understanding these characteristics allows orthodontists to design effective treatment plans that move teeth predictably and safely. Optimal force levels. In orthodontics, the optimum force level refers to the ideal amount of mechanical load applied to teeth to facilitate effective movement while minimizing the adverse effects such as root resorption, pain, or damage to the periodontal ligament. This force should be sufficient to stimulate cellular activity for bone remodeling, but gentle enough to preserve the health of surrounding tissue. Continuous force maintain a relative constant magnitude over time as seen with fixed appliances like braces. Interrupted force decreases to zero between activations such as with a certain removable appliances. Intermittent force applied and removed periodically, often associated with removable appliances worn for specific durations daily. Center of resistance. Definition. The center of resistance refers to a specific point within a tooth or a group of teeth where if force is applied, the tooth will move linearly without any rotation. This point is analogous to the center of mass in physics but is influenced by the surrounding periodontal structures. Applying a force to the center of resistance results in pure translation, whereas force applied elsewhere can cause tipping or rotational movements. Location of center of resistance. The exact location of center of resistance varies based on several factors. Single rooted teeth, typically located approximately one-third to one-half the distance from the center of the cemento-enamel junction to the root apex. Multi-rooted teeth, generally found between the roots about 1 to 2 mm apical to the furcation area. Influencing factors. The position of the center of resistance can shift due to the change in alveolar bone support, root morphology, and periodontal health. For instance, bone loss can move the center of resistance apically, while root resorption may shift it coronally. Location varies with root length and bone support. Moment and couples. Moment, rotation around a point. A moment refers to the tendency of a force to cause rotation of a tooth around its center of resistance. It is calculated as the product of force and the perpendicular distance from the line of action of the force to the center of resistance. Couple, two forces producing rotation. A couple consists of two equal and opposite forces whose line of action do not coincide, creating a pure rotational effect without any translation movement. Types of tooth movement: tipping, Bartley movement, rotation, intrusion, extrusion, and torque. Different types of tooth movement. The tipping, two types: uncontrolled tipping and controlled tipping. The anchorage requirement is moderate to minimal. Bartley movement, high anchorage requirement. Intrusion and extrusion. For intrusion, it is high anchorage requirement. Extrusion, low to moderate. For rotation and torquing, it is high to moderate anchorage requirement. For uprighting and dislocation, high anchorage requirement. Then springs. Removable orthodontic appliances like those utilizing springs exert forces on teeth to move them within the mouth. The mechanical principles behind these springs involve applying forces that induce tooth movement primarily by tipping and maintaining these forces for the duration of treatment. How springs work? First, force application. Springs are activated by stretching or compressing them, which generate a force that transmitted to the teeth. Control tooth movement. The design of the spring and its activation allow force control for control tipping, retraction, or other specific movements. Adjustable force. The force applied by spring can be adjusted by modifying the dimensions of the spring or by changing the amount of activation. Factors affecting spring force. Wire type. The type of metal wire used in spring can affect its flexibility and force. Wire size. Thicker wires generally exert greater forces. Spring length. The length of the spring influences its force and deflection. Then activation. The amount of spring is stretched or compressed determines the force it exerts. Then center of resistance. The spring should be passed as close as possible to the center of resistance of the tooth to minimize unwanted rotation. So, spring material and activation. Stainless steel is commonly used for springs and they can be activated by opening the coil slightly to apply a controlled force. Retention. Mechanisms like clasp are used to provide retention and prevent displacement of the appliance when vertical forces are applied, such as with Z spring. Biological basis. The tooth movement in orthodontic treatment is a biological process where the application of force induces bone resorption on the pressure side and the bone apposition on the tension side. Then screws. The mechanism. The screw is a central component with threaded shaft that rotate within a corresponding threaded component in the acrylic plate. Force application. Turning the screw applies a force that pushes the palate and the teeth apart, creating space. Tissue response. The force from screw causes the tissue and bone on the palate to respond, leading to expansion and separation of the teeth. Controlled expansion. The screw design, including the thread pitch and the material, influences the rate and amount of expansion. Retention and anchorage. The appliance also includes clasp or other retention mechanism to ensure the appliance remain in place and that sufficient force is applied to the teeth. Expansion and tooth movement. The expansion process can be used for various tooth movement, including tipping, expansion, and even some anterior or posterior movement. Patient cooperation. Patient cooperation is crucial as they need to turn the screw regularly as instructed by the orthodontist. The force and displacement. The amount of force applied and displacement of the teeth are influenced by the patient's individual tissue properties and screw design. Anchorage in removable appliance. Definition and significance. Types: dental and extraoral. Strategies to reinforce anchorage. Advantage of removable appliance: patient hygiene, simple design and fabrication, adjustable. Limitations: reliance on compliance, limited to tipping movements, less precise control. Thank you.